Let's talk about Wellbutrin or bupropion, which is a fan favorite because I take it. It's an antidepressant. It works on dopamine and norepinephrine the same as a stimulant does. That being said, it is not a stimulant. Unfortunately, because I think people hear this, it has been abused at parties or in prison or jail, crushed up, snorted, and does lead to higher risks of, or higher incidences of seizures because there is that risk with Wellbutrin, a higher risk of seizure with overdose. Seizure risk is one of the things we need to be aware of when we're prescribing Wellbutrin. We want to ask our clients, do you have a history of any seizure disorders? And things like that, because it does lower the seizure threshold. So we want our clients to know this, because also what else lowers the seizure threshold? Drinking alcohol. And so it's a fantastic choice for people who really are dealing with that depression and poor concentration, fatigue, but we want to be aware of that. It can cause a false positive for amphetamines on drug screens, so be aware of that. It can be helpful for smoking cessation. The dosing, it's different formulations. It comes in sustained release and extended release. Max dose for sustained release is 400 milligrams, and it's supposed to be taken no shorter than 8 hours apart, or no less than 8 hours apart from one another, with the dosing twice a day for the sustained release, because that can increase the risk of seizures. And then the max dose for the extended release is 450 milligrams. So if we're using it off label for like ADHD, it might make sense to do the sustained release to give people a bit more coverage throughout the day, if they'll remember to take that second dose. And if we're using it more augmenting for like depression, the extended release might make more sense. I have noticed that people who take the sustained release notice more of like a immediate release type effect, where they feel like it kicks in more noticeably in the mornings, and some people like that when they kind of struggle with that lethargy in the morning and just kind of a hard time getting going. And bupropion does come in immediate release as well. So anyway, I think that was one of the ones that cut off. Some contraindications to Wellbutrin: bulimia, anorexia, seizure disorders, that type of thing. I think that's pretty much it. I'm Lindsay, I'm a Psych NP, and